Hello, my name is Dr. Lori Russell Chapin, and I'm a professor of education and human development counseling at Bradley University in Peoria, Illinois. For the past 17 years, I have been teaching, counseling, and conducting supervision. Being a part of a supervision team is one of my very favorite counseling roles. These experiences have taught me that there are different supervision approaches for meeting supervisees' needs. Today, my colleague Brian Deneur and I will present a live demonstration addressing 4 major clinical supervision models and 1 supervisory videotaping method. The supervision approaches are developmental, integrated, micro-skills, theoretical specific, and interpersonal process recall. Portions of Brian's counseling interview will be shown, and then I will supervise the session from these 5 distinct supervision approaches. Our goal is to offer each of you feedback from each model and ways to interpret the counseling interview depending on supervisory questions and needs. Hi, Brian.
Hi.
Thank you so much for joining me.
You're welcome.
I really appreciate this. I know this will be a little bit different format than you and I are used to. Normally what we tend to do is as you know, the case presentation, we watch the video, and then we process through supervision.
Right.
You had mentioned last time that you've been wanting to expand your supervisory roles.
Right.
So I thought today it might be fun to do supervision, watch a little bit of your videotape, probably not the whole 50 minutes, but maybe 15 minutes.
Okay.
And then I will process and try to demonstrate from these 5 distinct approaches.
Okay.
What do you think about that?
That sounds great.
Sounds okay? All right. Well, first of all, Brian, would you please introduce yourself?
Sure, absolutely. My name is Brian Deneur. I work at the Illinois Institute for Addiction Recovery at Broman Hospital. I recently graduated from Bradley University. I have a master's degree, and I'm also a nationally certified counselor.
My model student,
Yes,
a model student.
yes.
And so you're still continuing to work there, is that correct?
Correct.
Okay.
I've been working there now for about going on 5 years.
Wow, it's a long time.
Yeah.
Now I know the portions of this video that we're going to be showing, Brian. Did you receive permission to show this tape?
Yes, my
Okay.
client that I work with, Sydney, did sign a consent form.
Okay. Well, tell me a little bit about the case, and
Sure.
then we'll move from there into the DSM-4-TR diagnosis.
Sure, that sounds fine. Sydney's a 53-year-old Caucasian female, recently divorced after having a marriage of about 20 years. Her main presenting problem when she came into counseling was really that of having an adjustment disorder. When she came in, she was having a lot of difficulty with some conflicts between 2 things, really, having a lot of guilt regarding the desire to get into some new intimate relationships, and still really dealing with a lot of hurt and a lot of pain from the past relationship, from her divorce. And so what we really focused on through the course of especially this session and a few of our other sessions was trying to help her kind of work through some of that hurt, letting go of some of that hurt, and beginning to look at identifying what her needs are and how to make that known to some of her new people that she's wanting to get into relationships with, and really getting her to the point where she feels comfortable and is really feeling not as much of that guilt in exploring some of these relationships. She also has some issues of low self-esteem, which for Sydney, she has been able to identify and trace those things back really to their origins beginning in her childhood. And we do talk a bit about that in the session as well. So the main focus in the counseling sessions really has been exploring some of her feelings and really looking at getting her to the point where she feels more comfortable exploring new relationships.
If you were to, at this juncture, give her a diagnosis of a DSM-4-TR, what would it be, Brian?
The 5-axis diagnosis on axis 1, I really see it being an adjustment disorder, chronic with depressed mood.
Okay.
On axis 2 would be a V code, the V71.09, which is basically no diagnosis on axis 2.
Well, let me stop you just for
Sure.
a second. And how did you determine the no diagnosis?
Really, on axis 2, that determination was made by the history that I have gotten from her. We'd really, in our initial assessment, initial interview, really went through a fairly lengthy biopsychosocial assessment, and really at that point in time, based on what her history is and what I could gather from other family members, and that there really has been no history of anything that would really indicate any kind of personality disorder.
Okay.
On axis 3, that was deferred. There are no medical conditions that I'm aware of, past or present. On axis 4, really the main thing right now is really some family discord that's been created since the divorce. It seems to be the main thing. On axis 5, the global assessment of functioning at this point in time, I assessed it being about an 80, should be her current level.
All right. So you have a good idea of assessment of Sydney. As you always know, I always ask the question, what is the supervisory question that you're bringing into supervision, Brian?
The main question that I have in working with Sydney was really, what could I do? How could I help the client get into the process?
Okay.
Being able to focus more on affect, being able to stay with her feelings. One of the things that Sydney tends to struggle with is being able to stay with those emotions. Once she can identify some feelings, she has a tendency to kind of back off from that and really kind of get back into some storytelling and getting back into her mind, so to speak, and really getting away from the feelings. So my question really is, what can I do to help the client stay focused, be more in touch with feelings, and really get into process counseling?
So as we watch the videotape, those are the things you'd like me to attend to?
Right.
Okay. Well, let's go ahead and watch the videotape.
Okay.
Probably the viewers will only get to watch about 15 minutes of it, but I think it's enough, Brian, for them to get an idea of your skills and perhaps some of the areas of strength and possibly areas of, well, things you might want to improve upon.
Right.
How would that be?
Sounds good.
Okay, great, thanks.
Boundary, and his self-worth was his self-image and his strength and stuff. He wasn't real tall. He's about 5'10" or 5'10 and a half, but he was always very muscular. So all the boys, they were afraid of him because he was, really broad-shouldered and not a bit heavy. There wasn't an ounce of fat on him during that time. And he did have a very, very bad temper, which I'm sure he got from his family. And my mom did too. But he was also a loving person in his own way. And after he had a stroke, then it came, time for Bob to get out of school, and he was getting this offer to come up here. And I didn't know if it was right to leave home. And my mother, one of the best things she ever did for me, and I'm going to cry again, but it's one of the things she gave me that I was able to give my children, was to tell me to go. She said, this is your opportunity, this is your chance. You need to go and see where it leads and what it has. You cannot stay here. This is where the opportunity is, you go. And I think it's because she regretted not having done that, because when my father was in the service, they were in California for a while. She was in San Diego and she loved it. But then when he got out after the war, they went back to Texas, and I think truly her heart would have been in San Diego. That was probably the best part of her life. And then they moved back to Texas, and his family was a mess. So, they always had that pressure and stuff on. And I think that's why she told me that. And very, very hard to do. And my family used to say, I love you. She and I, in fact, had to go into the bathroom to close the door to say that, when I was leaving. And, that always really touched me. But yeah, she and I were just in the bathroom when she told me, you need to go. You need to make this choice. You don't stay here because of us. We'll take care of ourselves. You need to go, and you need to give yourself a chance and give yourself a life. And for her to say she loved me, I don't think I even knew this would be like this. But therefore, it gave me the ability to give my children wings. And I look at the people whose family, the parents are so involved in their lives, even people my age, and still tell them how to run their life. That's not right. We have those children to raise, and then our part and our gift is to give them those wings and let them fly and trust in their abilities.
Let me ask you something here. Where you're at right now in your life, if your mom was sitting here, what would she tell you?
I don't know. I haven't thought of that. She was so sick at the end. I miss her more now than when she first died.
Think about that time that you were just recalling, and she shared that great gift with you of take this opportunity. You need to.
I think she would probably tell me to do what I'm doing, work on me, and do it, and get on with it. And, she'd be a cheerleader for me. She would be. My father, who knows? It'd still be weird. But, she would encourage me. But then after we got married and we lived up in Illinois I don't remember if this was the first year or like the second year we went back home. I can still visualize it because I still remember we were standing in a Sears department store the mall, I can't even remember what it was called now, but in Fort Worth, and my aunt was there, My mother was talking to my aunt, and for the first time, I heard her say that she hated my father. And that she didn't want to, that she was stuck taking care of him now, that she was going to leave him. And then he had the stroke. She was just waiting for us to get big and, get on our own, and she was getting ready to leave him. And then he had the stroke, and she couldn't leave because she didn't want to leave the burden of him taking care of him on the three of us. So she stayed there and spent the last 25 to whatever number of years, close to 30 years, being a martyr and hating him and turning bitter, and it was horrible. And I always told my kids I would not do that. I wouldn't ever be a martyr for them. There, if I got to the point where I couldn't stand their dad, I'd leave. Funny thing is, I was doing exactly that. I was getting to the point where I really wasn't happy being there, but I couldn't leave. And so on the good part, as much as I have a real problem with my emotions toward the person that my husband's married to now because of the circumstances, she probably did me a big favor. Because I would have just stayed there and been miserable. I didn't know how miserable I was until I got out of it. But I think when I heard my mother say that, and then a short time after that, I ran into my best friend from elementary school through high school, and now she's in Virginia, but we're still good friends. I remember her telling me, and I never had the heart to tell her, and I'm glad I didn't, but telling me how great she always thought it was because my folks loved each other so much and all that stuff. And then at the same time, I know this inside of me, I know what my mother said, and I think something in me broke the day I heard that. Some sort of a wall came up between Bob and I at that point. There a fence went up. Because, I know Bob and I, when we were dating, we were basing on it, we talked about it and we looked at it and we wanted to be, or envisioned it being like my folks. Thought that was good and had no idea how unhappy my mother was. That she totally, and that's why I have to learn to be me in relationships, she totally put her away and was whatever he wanted her to be. And they never fought in front of us or anything. They yelled at us plenty, but not with each other. She just always agreed with them. But she didn't. And she never stood up to him. And she, kept all that resentment in. So of course, just like Bob saying, well, he wasn't going to be like his dad. Well, if you don't really do a conscious thing or work onto it, you do. And I was going right into it like my mom. I was terribly unhappy. And even though I'm sitting here crying, and these people are out here getting their Kleenexes because this is such a good story, I really am the happiest in my life I have ever been being me in these last 5 years. And I will not say that first year or two was great. No, I never hurt so bad in my life. I think one of the ways I would put it is when that all happened, I never knew you could hurt that bad and not die. I think that's the only way I could put it. I didn't know that you could hurt like that and not die, and I wanted to. But I wouldn't, and I knew that was the easy way out, it went through my mind, but my kids, my friends, my sisters, my husband's family, everybody was there for me so much. And you see that, when somebody commits suicide, the people that are left are sitting there thinking, what could I have done different? What did I do wrong? And then, of course, there's the anger at that person. I thought, how could I do that too? Of course, again, that comes my caretaking, so that's probably good too. How could I do that to all the people that have been there for me? If I took the easy way out, what would that say to them? You weren't enough. So, keep on plugging along. But I have, hit a few things as I've gone through here. And of course, when the kids were younger, I was always worried to death about dying or something, not being there to see them grow up. Well, they're on their own. And when they do ask me their advice, by working programs and stuff I'm working on, I can, most of the time, do the right thing, which is say to them, well, what do you want to do? Or what do you think is the best choice? Or I can say to them, you've always made good decisions, so you go ahead and make your decision now. You've always made good ones. And encourage them, and give them some of that stuff, which I try to do. And I'm no longer afraid of dying. I'm not planning to do anything, but I'm just not afraid of it because I just look at it like it's the last great adventure because nobody truly knows what happens then. And even if it's like just going to sleep and that's just that, There's nothing bad about that. If you go and there's some kind of heaven or something different, well, shoot, that's just the bonus points. So I just look at that as the last big adventure. And that's a real relief not to worry about that anymore. You know, when the kids are younger and you're worried about what would happen to them, who would be there for them. Because I did have a scare with a breast thing, but it turned out not to be cancer. But, you know, of course, being a mom and kids are that age, you have yourself dead and buried before the results get back. But by that time, Bob was so much in his own world and stuff, too, that, you know, I thought about it and I was so worried about my kids if something happened to me, who would be there for them. But I also knew that I had wonderful, wonderful friends. And maybe that's my relationship with God, which is much better now than it's ever been. But at that point, I found that the hardest points like that, there's a peace that comes over me. And I do get an answer, which is that, you know, they'd be all right because those friends that love me so much would make sure they would. I would love them. So, and that's, you know, I don't know. I mean, what does God look like? What is God? I don't know. I just know that there's something out there. And if I listen, like right now, while I'm feeling so confused, I know that I'm supposed to be learning something and working on something, because that's what he always does. And I know that I'm getting impatient because I want the answer right now. That's why I'm getting restless. But if I wait and I listen, I will know. Because God hasn't failed to tell me yet. Sometimes I have a little trouble deciphering between my will and his, so I have to watch that. But, you know, I never thought I could be where I am today. Never. And never even imagined it. And be as happy as I am today. Despite the tears, because tears aren't necessarily sadness.
You have definitely worked through and are working through, you know, a lot of that pain and that loss that's been there through your life, you know, through issues with your parents and your ex-husband, and still kind of grappling with, you know, how you're even feeling about yourself and maybe relationships or situations in your life right now.
Yeah.
Before we wrap up, I guess what I'm again, kind of like I ask every session, what really kind of stood out to you? What really, feeling-wise, what really stood out to you from today's session?
Maybe the, you know, being able to voice and to say the thing on that what I do want in life and recognize that as a partner. Then on the other hand is knowing if I deserve that or if I'm expecting something that doesn't really exist, that isn't possible, and should I just settle for what I have? And yet that's what I've always done, and I don't want to. And I know, honestly, I'd rather be on my own, be by myself the rest of my life than be with the wrong person. Because I have a pretty good time with me.
Does that feel like something maybe we should come back to?
Probably, because I know that's what I have to work on.
Okay. Well, how about the next time we meet, we'll kind of see where things are at, maybe find our way back to that issue and see where things are at.
But I do know, I will say, because I know I've said that Jerry's bossy and pushy and stuff, he is. But I've also realized that a lot of it's my fault. You know, if you let the other person be bossy and pushy, they're going to be bossy and pushy. When you don't say, don't do that, how do they know? And I've gotten better about that, and I have definitely, I guess that's where I start to feel guilty, is because I have seen him working to make changes. And after I said that to him, he had played cards one night with a bunch of people and was real late getting home, and of course, you know, the gerbils had come. Because, you know, he hadn't had that many friends, so I'm so glad that he's making friends there, because he needs it. And even if he's seeing somebody else, if that's the person that should turn out that should be in his life, then I am glad for him. But the gerbil's going to say, well, you're a loser. Well, no, I'm not a loser, because if he finds the person he should be with, that would, in its own way, be a relief for me. Because I'm, you know, pretty positive he isn't. You know, I'd love to keep a friendship with him forever, but I don't know that that can even happen. I know that's pretty tough for a lot of people, but it seems like I end up being best friends with the guys after a breakup. I don't know. I do better for him always than the other.
And I think that comes back again, like you were talking about, being able to verbalize your needs, being able to verbalize
things as they come up, as opposed to letting them stew and just not address